Namaskar, hello, a warm welcome to all. We underscore developers are glad to present to you our solution to the problem statement that talks about an AI assisted telemedicine kiosk for rural India, which is from the organization Government of Kerala. So basically, one day I was surfing on the internet and I found that there are approximately more than 6 lakh villages in India. And also, according to the World Bank, rural population in India accounts for about 64.13% of the total population. Hearing this, it clicks in our mind that maximum population of our country is concentrated in the rural areas. But unfortunately, this population is facing a lack of proper healthcare facility. By this one, we can easily understand why we need a telemedicine kiosk in the rural areas. We need it to establish a one-to-one interaction between doctors and people living in the villages. Now, let's see the idea and its solution. So, our main idea is to provide healthcare facilities to the rural dwellers with the help of telemedicine kiosk. Now you might be wondering, what is a telemedicine kiosk? So basically, it is an interactive, self-utilized machine with specialized software to provide clinical support to the patient without physically visiting a doctor. Moving on towards the solution, here the kiosk will be set in an approximately 200 to 250 square feet area with the help of government. It will be able to perform various primary health tests like temperature, blood pressure, sugar, SpO2 and etc. If asked by the doctor, other health tests can also be performed by the trained medical personnel. When the patient will approach the kiosk, first he will be registered onto the software with the help of ASHA worker via biometric scanning. After the successful registration, patient will be asked about his illness with the help of a questionnaire. Then, as per requirement, patient will be connected to an expert doctor via eSanjeevani app to interact with the doctor through video conferencing. After the consultation, if there is any requirement, health test will be performed and the prescribed medication will be provided to the patient via local ASHA worker without any delay. All the health related information of every visit of the patient will be stored onto the encrypted database of our Arogya portal. The technology stack used by us here in the making of our Arogya portal is Python programming language plus Microsoft SQL Server and VB.NET. Let's discuss about the approach details. So the use cases of our kiosks are as follows. As we all know that regular health checkup is a need of pregnant women and elderly people. So this kiosk will be of utmost benefit to them as traveling in order to meet the doctors who are far away is not a feasible as well as safe option for them. Expert as well as specialist doctors will become available to the rural people. As there will be health tests available, there is no need of the patient to travel long distances in order to get the test done and bring back the test reports on another visit to the same faraway place. Like for example, the blood sample of the individual will be sent to the pathology laboratory and the report generated will be sent back to the proposed health center which will be used for further diagnosis. In this way, healthcare facility will reach every nook and corner of our country. Let's move to the unique features. As stated, doctors will be available 24/7. Patients will be diagnosed and treated without in-person visit with a doctor. Based on the stored data, Health Ministry can make different health-related schemes and can initiate various health programs. And the most important unique feature is that after linking the data on the Arogya portal with the Aadhaar number or phone number of the patient, we can overcome the fraudulent use of government funds, as it will help us to know if the receiver is truly the needful person or not. And our dependencies include the ASHA worker, eSanjeevani app, and internet connectivity. So at last, everybody in the society deserves equal treatment related to healthcare facility. And our main motive is to make our kiosk reach out all the places, all the possible rural areas and make the people get what they deserve. Keeping in mind the famous proverb which says that many hands make light work. So the hands involved in our project are our team leader Sudarshan Praveen Bari, Member 1 Vaibhavi Nimba Patil, Member 2 Avni Ashish Kapoor, Member 3 Akash Anil Dhamne, Member 4 Aniket Praveen Patil, and Member 5 Smith Jayesh Sechpara. And our team mentor Professor Mr. Sagar More, who has an expertise in machine learning and has a domain experience of 7 years. That's all from our side. Thank you.